Welcome to The Standard. From Vancouver, I'm Peter Klein. Tonight, an insider's view on two of the most powerful houses of power in the world. Coming up, what's really going on at the Iranian presidential palace. We'll sit down with the first Iranian cabinet minister to be fired by Mahmoud Ahmadinejad, the man some believe may succeed him in the Iranian presidential election someday. But first, a glimpse inside a presidential mansion closer to home, George W. Bush's White House. It's been just over a year since U.S. President George W. Bush left office. One of the last people standing with him at the White House was Scott Stanzel, the president's deputy press secretary. Mr. Stanzel has been a major player within the Republican administration as far back as the Florida recount of 2000 that brought Mr. Bush to office. Mr. Stanzel joins me from Seattle. Welcome.
Thank you, Peter. Nice to be with you.
So you are someone who's worked with George Bush and other major political leaders for many years, helping them craft their image. Let's talk first about the current president, Obama. What do you think is going on in terms of his image crafting? I mean, his poll numbers have plummeted recently. What are they doing wrong?
Well, I would say that they started potentially maybe at an impossibly high level. Obviously, there was a lot of expectations coming out of the 2008 election. And I'm not sure that a lot of people had a full awareness of maybe the policies that he planned to pursue as president. Undoubtedly, his message of change in the 2000 election was one that voters identified with and largely brought him to victory. But once you start putting some policy behind your actions, that's when people are going to start to choose sides. I think over the course of the past year, they've had a very difficult time with their health care push. Obviously, many Americans during this down economy are having difficult economic times for themselves. A lot of Americans, 4 million rather, have lost their jobs in the past year. So that tends to be the first priority for people around this country in terms of what they think should be the focus. And their focus on health care, in my view, has been a bit misguided. You've seen in the polls that President Obama and the proposal that the Democrats are pushing for is not very popular, and I think that has been a drag on his presidency.
If you were working with Barack Obama, would you have told him to hold off on health care until the economy's more stable?
I think I would have. I think that coming out of the election in 2008, certainly we had the financial crisis that hit in September 2008 and became the dominant issue in that campaign, and I think it would have been better for the president to stay laser focused on improving the economy. There have been several times, really over the past year or so, when his administration and members of his staff and his press secretary even have said, well, the focus is now going to be on jobs, jobs, jobs. And that happened really as late as a month ago with the State of the Union, and even after that, they said their message was going to change to jobs, jobs, jobs. But even today, President Obama is out talking about health care, and that's his focus. So I think that's been a bit of a distraction for both the president and for members of his party, and it's one that has demonstrated a bit of a disconnect, if you will, between what their priorities are and what the priorities of the American people are.
Well, you know, from the perspective of north of the border here in Canada, I think a lot of Canadians, from all political perspectives, look at the debate in the United States and kind of scratch their head a little bit and wonder, why wouldn't the average American, regardless of what party they're in, want universal health coverage? I mean, how do you answer a Canadian who's sort of confused by all that?
Well, it's a very good question. And one of the things that doesn't get talked about much in this debate is that the vast majority of Americans do have health coverage. They do have health insurance.
But 40 million don't, right?
Actually, that number is a bit high. So about 10 million of those people are eligible for coverage, be it through Medicare or Medicaid or other state insurance programs. So the number drops down. Then you take about 10 or 12 million people that are in this country, in the United States, illegally. That's actually a whole separate debate as to whether or not they should be covered. So by the time you start to pare that number down to either people who have coverage or are eligible for it, it gets to be half that or less. Certainly, that's an issue that you need to tackle if you're a policymaker to find out how you can get those people to have health coverage. But of the people who actually do have health coverage, the vast majority are happy with it. There's wide agreement that the system can be improved, but there's wide disagreement about how to improve that. And because of all the spending that's coming out of Washington, D.C., people are uncomfortable with big new federal programs because there isn't a lot of confidence that programs out of Washington can be run in a way that are fiscally responsible and effective. And I think that's what has been a drag on this debate.
Well, you're from Iowa originally, correct?
That's correct, yeah.
In American Heartland, you worked with Bob Dole, senator from Kansas. There was this book a few years ago, What's the Trouble with Kansas?
Right.
That book, and I think certainly other Democratic or left-leaning commentators have put the question forward that, why is it that the Democrats have not successfully connected with people in the heartland? The Democrats sort of put themselves forward as the party of the average folks. They characterize the Republicans as the party of the rich, and they're the party of the middle class. And yet you see states like Kansas, routinely voting Republican. Why do you think that is?
Well, I think it can go to a lot of different reasons. Whether it's the focus on social issues, there are a lot of what we call values voters who are more focused on, say, the social issues of gay marriage or abortion or things like that are drawn to the Republican Party for their more conservative approaches on those issues. But in terms of, say, the working man and people out in the heartland, I think there's a lot to be said for the Republicans' approach. Traditionally has been they're the party of opportunity, party of individual freedom, party of personal responsibility. And I think that's a message that does resonate with people out there that are working hard to make a living and provide for their families. Whereas sometimes the approach of the Democratic Party is more of a collective approach, more assistance, say, coming from the federal government. And that's not something, say, in the heartland that people are really looking for. And then
you look at something like the Tea Party, the group in the states that's pushing issues about taxes, concerns about the taxes are going to go up. When in fact, my understanding is under Obama, taxes for the majority of middle-class folks has actually gone down. That's not something that's discussed in the Tea Party circles.
Well, the taxes, I don't think that you can say that across the board, even when you throw in things like, say, the smoking tax. There's a tax that on cigarettes that has gone up. And it certainly hasn't been President Obama's approach to drop those marginal income tax rates. In fact, the Democrats are set to allow the Bush tax cuts that were passed early in President Bush's first term. They're set to allow those top rates to expire next year, which would be a tax hike on a lot of small businesses. So I think more so, though, however, than taxes, the issue is spending. And the $787 billion stimulus plan made a lot of people uncomfortable. And you have the bailouts of banks or auto companies and that sort of thing, that people see the federal government outlaying tremendous amounts of money, and it seems like a real disconnect from what they're having to do in their own personal lives, which is to save and conserve and try to weather this downtime.
Well, Mr. Stanzel, you were privy to some of the most important moments of the Bush presidency. We have to take a short break, but when we come back, we'll talk about George W. Bush's legacy and your experiences in that administration. Back in a moment.